And one of the really interesting thing when I was reading your interview and Melanie's interview and a bunch of other people's writing is the economics is hard for the industry. And like you said, you also mentioned the lack of labor, of trained labor in this industry as well. Like how does this kind of software help with that kind of economics? And is there anything else that you would like to add to this so that it could be even better and something that we need to develop in the future?
Gosh, do we have 2 hours for a whole nother webinar? Because
No.
that's that's a big topic. But to
Okay.
say it succinctly, the economics really makes sense in the local context only. And so it really comes down, unfortunately, everybody in our field, at least in the US side of things, knows it comes down to reimbursement, and that comes from insurance companies. So the same device on a Medicare contract versus a United Healthcare contract, we have to understand how we're getting paid. And sometimes the economics is upside down, but that's true even with standard traditional fabrication methods, right? So the economics here to me is quickly making designs, having designs repeatable, taking advantage of additive manufacturing to make devices actually better. So I started using 3D printed foot orthotics like 7 years ago because they were better than traditional orthotics. They
Hmm.
were more expensive, but I said, you know what? For the right patient, this is the right thing. It's better. I want better for my patient. So I
Hmm.
said, I'm just going to do it and eat the $5 or $10 extra because it's better. Well, now the cost of printing has come down. Now there's economies of scale. And really, one of the other things is the cost of labor has gone up. So, I mean, I don't have
Right.
anything against technicians. It's just, it's hard to find a good tech. It's hard to
Yeah.
maintain a good tech. And it's hard to keep a good tech busy in small offices. So 3D printing, especially in large batches or on-site point of care sort of things, there's all sorts of ways to use FDM, to use SLS, to use MJF. There's definitely a learning curve in understanding which technology stack is right in which environment. And some people are going to do
Hmm.
it in-house. Some people have local printers in their city. Other people work with people like Joe to make stuff happen. And so there's all sorts of ways to kind of slice it, and it just depends on the office and what they need.
Yeah, you're absolutely right. And I didn't really think about the local factor because if you're in an urban area versus rural area, the cost of living and population density, um, everyone has a different story in terms of how to build their workflow.
Yeah.